Hi, Muhammad Al-Mala here. Today we're going to talk about something that eventually affects all of us, presbyopia. It's a very common condition, but yet I find it's really frequently misunderstood. So, what is it? What are the symptoms of presbyopia? We'll talk about the symptoms first of all, and then we'll talk about the mechanism of presbyopia, and then we'll talk about ways to treat it and ways to manage it. So presbyopia starts affecting us mainly in our mid 40s. Some people can be a little bit earlier, late 30s or so. And on the symptoms are different for different people. If you have never had to wear glasses before, you probably notice in your late 30s that it becomes harder to see things up close. You have to hold things further out to see them. And then you start wearing glasses to read. But then as you go through your 40s into your 50s, you start needing to wear glasses not only for reading, but also for distance. And the reason that is because you've always really been hyperopic. Hyperopic means you're farsighted. You've always been farsighted, and that has resulted in, but that's covered when you're younger because your lens is able to accommodate, it's able to focus through that farsightedness. But the lens starts to lose that ability in your late 30s or so and into your early 40s. And as it does so, then that hyperopia or farsightedness becomes unmasked. It becomes harder for you to see up close and then becomes harder for you to see distance and up close. We call that latent hyperopia. So that's one group of people, and that's how presbyopia can affect them. Now, for people who are nearsighted or myopic, presbyopia affects you a little bit differently. When you're nearsighted, you're used to always wearing glasses for distance, or you're used to wearing contacts for distance. But without your contacts, without your glasses, you see pretty well up close. Well, when you become presbyopic, you can still see up close without your glasses or contacts, but you'll notice when you're wearing your glasses that it gets harder for you to see up close. And as you go through your mid 40s into your early 50s, you start finding that, you know what, when I wear my contacts or wear my glasses, it's really hard for me to read. It becomes hard to see the computer. And people who wear contacts will often find themselves having to reach for reading glasses over their contacts to be able to see up close. So that's how presbyopia affects people who are myopic or nearsighted. So we've talked about how presbyopia affects people who are farsighted, people who are nearsighted. What if you're born or blessed with eyes where you're not neither nearsighted or farsighted? We call that emetropia. So if you're neither nearsighted or farsighted, we call that emetropia. And if you're emetropic, then you see well when you're younger. You see well for distance, and you see well for up close. And as you become presbyopic, you will find that it gets harder for you to see up close, and then eventually, you wear reading glasses, but you really don't need any glasses for your distance vision, and you just need to wear glasses. You just have difficulty seeing up close. So, what's the mechanism? Why do we become presbyopic? When we're born, we have a lens. We're all born with a lens in each eye, and that lens helps to focus the light onto the retina. As light comes into the eye, it's focused by the cornea and then by the lens, and the light lands in the retina, and then the retina processes that light into electrical signals and sends it through the optic nerve to the brain. When we become presbyopic as we age, as we come into our mid 40s, that lens becomes less flexible, becomes stiffer, and so that lens can no longer change shape instantaneously like it used to when we were younger. And it becomes as that presbyopia, as that process develops over our late mid 40s into our 50s and late 50s, the lens becomes focused at just one point. And so we can't just wear glasses for one point. We have to wear a different prescription, use different prescription to see distance and different prescription to see up close. That's the mechanism behind presbyopia. So we've covered how presbyopia affects you, what the symptoms are. We've covered the mechanism behind presbyopia, the lens getting stiffer. So what options do we have to treat presbyopia? Well, probably the most common option is for people to wear glasses. So instead of wearing single vision glasses that are focused just one distance when you're younger, you start wearing glasses that are progressive lenses or bifocal lenses. The glasses have a prescription for distance, prescription for up close. Then with progressive lenses, you can see all the different distances in between. That's one option. Well, some people don't really like wearing glasses and they wear contact lenses. And if you wear contact lenses and you're presbyopic, you can wear your distance contact lenses and wear reading glasses over them. Some people like to do that. Other people like to do something called monovision. Monovision is where you use one eye for distance and one eye for up close. So you're never really using, I mean, you are using both eyes together, but both eyes are not focused together. And for some people, the brain is able to adapt to that and it works really well. And they do that for many, many years and they're happy with it. But that's definitely not for everybody. So those are some of the most common ways, probably the most common ways to treat and manage presbyopia. But if you don't want to wear glasses or contact lenses, then people will resort to vision correction surgery. And one option that we get a lot of calls about is LASIK. So LASIK is a procedure, a very successful procedure that reshapes the cornea to change how the light is focused as it comes into the eye. But it cannot treat presbyopia. Why is that? Because LASIK can correct your vision. Let's say you have LASIK to correct your vision to where you see well for distance. Well, that lens inside your eye, like we talked about earlier, is no longer flexible. So you'll see great for distance after LASIK, but you won't be able to see up close. So you'll have to wear reading glasses again. The other thing, one way that LASIK can work though, is if you have monovision again, one eye for distance and one eye for up close. Now, that is a way to treat or manage presbyopia, is to do LASIK one eye for distance, one eye for up close. But before you do that, you really want to make sure that it's something that your brain can tolerate and can get used to. So you probably at least want to try that with contact lenses first, or just have a good understanding of what it is that you're doing. So in terms of, let's just summarize, in terms of treating presbyopia or managing presbyopia, we can do glasses, we can do contact lenses, we can do monovision, one eye for distance, one eye for up close. We can do LASIK monovision, we do one eye for distance, one eye for up close. And then the final option really is to surgically treat presbyopia through having a refractive lens exchange. We just talked about how the reason we have presbyopia is the issues with the lens inside your eye. Well, we have a surgery that can change the lens inside your eye and have a new lens put in. We call that cataract surgery. But you can have the same surgery before you develop a cataract. The lens is removed, a new lens is put in. You can have a multifocal lens placed, which a lens allows you to see both distance and near because it has two focal points. Some of them have three focal points, so you get distance, intermediate, and near. And that is an option to definitively treat presbyopia, in that you are able to see distance and near without dependence on glasses or contact lenses. I tell my patients, there is no perfect lens. There's no lens that we can give you that gives you vision how you were when you're 20 years old, when you could just focus at distance and focus up close without even having to think about it, and that lens inside your eye would do all the work for you. We don't have a lens like that, but we do have lenses that can give you multiple focal points and really give you a good range of vision without having to be dependent on glasses. And we can talk about all different types of multifocal lenses and the different ways to do that. But that's also an important discussion. We can save that for another video. Hi, I'm Muhammad Omala. I'm an ophthalmologist. I practice in Central Florida. I see patients in Ocala and in the Villages, Florida. Follow this channel for more information about eyes and eye health and how you can have your best vision.